Hey everybody, welcome to another episode of the Science of Golf Performance. My name is Bobby and I'm the director of our physical therapy programs here at Par for Success. I've had a lot of people come in recently with some knee pain, whether that's on their lead knee or their trail knee. Really, there's not a whole ton of difference depending on which knee it is, but I want to give everybody a couple of quick things they can look for to try to help their own knee pain out at home, maybe save you some time going in person to see a physical therapist. Or a general practitioner or anything like that. So if you're having knee pain while you're playing golf or even after you're playing golf, especially as the weather's getting a little colder, those knees might be a little achy. Why don't you try a couple of these things out that I'm going to show you today? So I'm going to go over the 3 things that I look at in every single person that has knee pain when they come in here to Par for Success, regardless of where it is. The first thing I want to talk about is you're probably not seriously hurt and you probably don't need surgery. For most people, there's an achiness, a soreness, fatigue in the knee. Really, the only times you need to be seriously worried is if you can't bend or straighten your knee all the way. If you can do both of those things and you can walk with even some mild achiness or soreness, I'm probably betting that the tricks I'll show you today will help you out, especially on the golf course. So the very, very first test that I'm going to have someone do, it's actually part of our home assessment to look at people's overall golf swing as well. And that's going to be a seated hip rotation test. All right, so if you're lacking in this department, you're going to put a lot of extra strain on various places in your body. One of the closest areas to your hip that's going to take that strain is going to be your knee. So the first thing I want you to do is just sitting on a chair, be kind of towards the front of the chair. What I want you to do is keeping your legs straight. You're going to try to rotate your foot out to the side. Now notice I didn't move my knee inwards. My knee stayed still. It's kind of why I have my hand on it. My hand's there. I'm rotating. Now I would say that that's fairly limited. What we like to see is about 40 to 45 degrees of rotation, and this would be on both knees. So if you can barely pick your foot up or if you can't even do that much, right, this is definitely something to work on. What I would suggest then is to grab a lacrosse ball and check out some of the other videos on our YouTube channel that work on hip mobility. Again, if your hips are limited in your golf swing, other parts of your body are going to try to take over and compensate for that lack of rotation. The hips are really designed to rotate, the knee not so much. So if you can't rotate through the hip, you're going to put extra pressure on your knee. Now, to help you feel a little bit better, the second thing I look at is if there's actually muscle tension in the knee. And I want to show you a couple ways that you can get rid of that muscle tension. And the couple of ways is with these 2 tools here. So this is a lacrosse ball for people that really want to get aggressive. And this is a softball for people that might need a little bit bigger of a tool to work on. We've talked in previous episodes why we don't love traditional foam rolling, right? People are taking the big foam roller. They're kind of flopping around on the ground. They're rolling up and down. That's not getting rid of those tight muscles the way you probably think it is, or maybe you've been taught that it is. The way we do it here at Par for Success that helps us get success with all of our clients is by taking, again, these 2 tools, finding the exact place of muscle tension, applying a moderately uncomfortable amount of pressure to those areas and holding it there. I don't know how many times I have to tell people how to hold a position and hold that tender muscle versus trying to roll around on it. Because rolling around on it does feel pretty good, right? It feels a little bit better to roll that muscle rather than to just hang out on one tender area and kind of fight through it. But the way our muscles and our nervous system works, just rolling is not going to get that muscle to release and feel better. So again, we've got plenty of videos on our YouTube channel that show you how to use these tools to release some of the muscles. I would say you want to check out your quads, you want to check out your calf. Those are kind of the 2 major muscle groups that cross the knee joint, all right? Now, the third tip and the third thing I usually look at is if someone can perform a couch stretch. Some of you might have heard of a couch stretch before. This is actually a stretch for the entire front of your leg. A lot of people are working from home more than they're used to. A lot of our juniors are staring at a computer screen a lot more than you're used to, and you're probably staring at a phone or a computer screen while you're sitting down watching this. The number of hours that we're spending in this sitting position is drastically outpacing the number of hours that we're in an extended position with our hip and a flex position in our knee. So what I'm going to do is I'm going to show you quickly the couch stretch. Again, we do have a video on YouTube, but I really want to take the time on this episode Because if you do nothing else, getting yourself to get into a couch stretch position, be comfortable with it, is very, very important. All the people that have had knee pain that have come to see me in the past few months, once we're able to get to a good couch stretch position, their knee immediately feels better. So if you can't get into this, let's figure out a way that we can so that you can start getting towards a healthier and looser knee. All right, so I'm in a couch stretch position right now. We call it the couch stretch because it's very easy to do if you have a chair or a couch or a box or a bench, maybe at your gym, to prop that back foot up on. Now, the first thing that you need to notice is I have a pad under my knee because we want that kneecap to feel comfortable. The second thing is I'm really bent over right now. I have something that'll help me balance, and this is really important if this is your first time doing this exercise. So what I want to do to really stretch the front of this leg is I want to try to bring my body up as far as I can. The second thing I'm going to do is I'm going to try to get my heel as close to my butt as possible. Again, lean the chest out tall, and I'm going to sink back. The third thing I can do to make the stretch more intense is I can actually squeeze my glute muscle. What it's going to do is it's actually going to push the hip forward, and I'm going to go to a slightly different view so that you can actually see that happen. Right now, I feel a big stretch all through the front of my leg, and this is going to get all of those quad and hip flexor muscles a lot looser. Again, trying to fight the amount of time that we're all probably sitting these days. So let me go into a slightly different view real quick so you can see the exact position of my back and my hip. All right, so this is a side angle view of our couch stretch. The big thing is to take note of the line of my leg versus the line of my body. I want to try to get rid of that line as best as I can. So again, I'm going to bring my chest up tall. I'm going to sit my butt back towards my heel. And when I squeeze my glute muscle, you should see that my hip comes slightly forward and I get a great stretch all in through here. I like holding this stretch for about 30 seconds. Super easy to do while you're watching a golf tournament over the weekend, maybe some football, maybe some college basketball coming up. This is a great thing to do a couple times per day. Again, we're trying to fight against the amount of time that we're sitting so that we can get all these muscles in the front of our leg loose, take some pain off our knee. Hope you enjoyed today's episode. If you liked it, throw me a like button. Always appreciate that. Subscribe to our YouTube channel. We're always putting new exercises and new videos to help all the golfers around the world get better, especially during this off-season period. So take care of your knee pain. Thanks, and we'll see you soon.